Hi, my name is Aryan Patu, and it's been 3 years that I've been dealing with generalized anxiety disorder. In this video, I will talk about what GAD is, the symptoms, and treatments. Generalized anxiety disorder, the most common anxiety disorder that involves chronic worrying, nervousness, and tension. It's pretty much making normal life difficult and relaxation impossible. GAD can be passed on from family members. Also, it affects you mentally and physically. Many people get GAD mixed up with being anxious. When you're anxious, you're worried for a week or two. It could be about an exam or even just being nervous about going on a roller coaster. But GAD, it could affect your daily routine and how you go about that. So you can, you're too afraid to go to school, or you don't want to go to work. It affects the way you socialize with your friends and family members, and sometimes you just you feel isolated. So it's more of worrying about a situation for months, even years. GAD symptoms. Mentally, you feel like you can't control your thoughts. You become mentally drained from how much you start worrying and overthinking a situation. So that could really do a lot when how you go about your day. Physically, it could have your heart pacing fast, shortening of breaths, being numb through the body, muscle tension, diarrhea, being nauseous, dizzy, and that could, if it's extreme, it could lead to a panic attack. A panic attack can last anywhere from 3 to 40 minutes, and it can go, like, of how harsh it could be, it can go from a scale of 1 to 10. So, like, let's say 9 being, like, the hardest, like the worst panic attack you've ever had. And, you know, I've had those panic attacks, and you just feel like you're dying, and it's hard, and sometimes it can lead you to go to the hospital. Now we will talk about the treatment. There's 3 ways of going about treatment. You can exercise daily, yoga. You can seek a therapist's help for advice on the situation and help you keep your mind off of it. Or you can take medication. Some common medications are Xanax, paroxetine, and Klonopin. I personally seek a therapist's help, and I take Paxil and Klonopin. With that being said, I've talked to a lot of people who've had GAD, and we all believe that medication is the wrong way to go about it. It's a placebo effect. You think that it's doing you good, but really you know that you're the one that's control over the anxiety. So anybody who has GAD, I recommend exercising or just seeking someone's help. With that being said, there's many other anxiety disorders such as OCD, post-traumatic disorder, phobia, social anxiety disorder, which we'll be talking about in our presentation later on. And to anybody else dealing with anxiety, just remember to stay positive.